Presenting AngioExpert, an innovative medical device based on FMSF flow-mediated skin fluorescence. AngioExpert enables non-invasive monitoring of the microcirculation, metabolic regulation, and vascular complications in diabetes patients. Testing should be performed in a warm environment with temperature and humidity control. The patient should avoid smoking, physical exercise, eating, and drinking alcoholic or caffeinated beverages for 2 hours prior to the test. Any objects that may limit blood flow in the arms, rings, watches, bracelets, or wristbands should be removed. Items of clothing that constrain movement, apply pressure, or make the cuff difficult to put on should also be removed. Before starting the test, blood pressure should be measured under resting conditions, and the patient's systolic and diastolic pressure should be recorded. While the patient is resting, their data is entered into the AngioExpert system on 2 screens. On the first screen is entered the patient's name and surname, age, sex, height and weight. It is also possible to note additional information about chronic diseases or medications by completing the comments field. On the second screen, the patient's systolic and diastolic pressure is recorded, as determined prior to the test. Before the test, the patient should adopt a comfortable sitting position on a stable chair next to the AngioExpert. The patient's back should be pressed against the back of the chair. The patient's legs cannot be crossed, and their feet should be flat on the floor. Once the patient is seated, adjust the height of the table and lock the wheels to immobilize the table and the device. Before using the AngioExpert, place the cuff on the patient's arm above the elbow so that its lower edge is approximately 1 or 2 centimeters above the elbow flexion. The cord should be in the lower part of the cuff, in the elbow crook. The cuff must be tight, but not too tight. It is important to adjust the size of the cuff to the patient's arm. In the next step, the operator positions the patient's arm in relation to the positioner on the device in the measuring window. The shoulder should be abducted in the horizontal plane at an angle of about 45 degrees. The arm should be gently bent to the elbow joint and placed on the support with the measuring window. The measuring window should be located approximately 6 centimeters from the elbow flexion at the thickest part of the forearm. The measuring window must be in contact with the skin of the exposed forearm. There should be no scratches, wounds, scars, tattoos, insect bites, large color changes or bruises on the forearm where the window is in contact with the skin. The patient's elbow should be placed approximately 2 centimeters from the positioner. During the test, the hand should be relaxed and supported, palm down, with the fingers in a straightened position. The patient should be instructed not to move during the examination. In particular, the patient's arm should not be removed from the measuring window, and the patient should refrain from moving. The test is initiated by clicking the Start button. This begins registration of the baseline, which takes 3 minutes. The baseline should be stable. In the case of an unstable baseline, the program may extend observation for another minute. Having registered the baseline, the cuff is automatically inflated to a pressure of 60 millimeters above the patient's systolic pressure, as determined before the test. This produces ischemia by occlusion of the brachial artery, stopping blood flow to the arm. If the pressure in the cuff drops, it is reinflated automatically. The start of occlusion is signaled by the appearance of the start of occlusion message on the screen. The occlusion signal is registered for a period of 3 minutes. The patient should be informed that for 3 minutes they may experience some discomfort. For most people this should be bearable. However, if it hurts or is too unpleasant, the test can be stopped at any time. The occlusion process ends automatically. The pressure from the cuff is then suddenly released. The blood flow in the brachial artery is restored and coronary hyperemia occurs. The program registers this response. During the test, the device operator observes the progress of the measurements on the monitor screen. Based on this information, the test may be stopped at any time. When the test is over, parameters are displayed on the screen. These parameters reflect the diagnostic functions of the FMSF technique. Interpretation of the parameters is performed by a doctor who plans further diagnostics and monitoring at intervals based on the patient's health status and individual needs.